Cerebral palsy is a neurological disorder that affects the movement throughout the body. The cause of it is different between each case, but the common causes are ruptured blood vessels, lack of oxygen to the brain trauma, or infection that occurs before, during, or after birth. There are also some cases that the cause is unknown. Doctors classify CP by motor function, which is divided into 3 categories: spastic, non-spastic, and mixed. Spastic CP causes tight muscles and joints, making it hard to move the body. The subcategories for spastic CP are quadriplegia, all arms and legs are affected, including their mouth or their neck. Diplegia, both legs or both arms are affected. Hemiplegia, the most common type, is when one arm and one leg on the same side is affected. And monoplegia, either a single arm or a single leg is affected. Non-spastic CP has 2 subcategories: dyskinetic, which is when the muscles of the affected area tighten and loosen, and ataxic, when the child's coordination and balance is affected. The last category is mixed CP. That is when a child has a combination of both non-spastic and spastic CP. In the U.S., 1 out of 323 children have CP. Around 10,000 babies are diagnosed with cerebral palsy each year. Almost 40% of people with CP cannot walk without assistance. There has not been a study done to determine the life expectancy of someone with CP, but they tend to live 40 to 70 years of age.
People perceive disability as a weakness, as an illness, as something that needs to be cured, and we have to fight against that. Someone said, "What's wrong with you?" And I was like, "What's wrong with me? What's wrong with you?" Like, I'm fine, man. I don't got any problems. I'm RJ Biddy. I am an actor. I've been on a number of shows, such as Breaking Bad and Switch to Birth. I was diagnosed with cerebral palsy around 3. I was in a lot of physical and occupational and speech therapy. I was what you would call a severe toe walker. What they would do is they would bend my foot as far as they could bend it, which was not fun, and they would cast it. And every couple of weeks, I would cut the cast off and bend it further, and then bend it further until the foot was flat. I'm always working at taking control. It's a fight. It will always be a fight.
Cerebral palsy is a non-progressive disorder, so it won't get worse over time. Through many different forms of treatment, a person can ease the symptoms but never cure it. The most common forms of care are medication and different types of therapy. The medications help the muscles to relax and make it easier for them to move their bodies. They will also endure physical, occupational, and speech therapy. Through therapy, they will stretch out the muscles and learn how to function and complete tasks with their disability. Speech therapy will help them learn to work through their CP and able to speak as clearly as they can. They also use casts to help reshape parts of the body. Another form of treatment would be to get surgery that will help with mobility, reduce muscle tightening, and reduce the pain. Selective dorsal rhizotomy is a procedure that cuts off nerves in the spinal cord that cause irregular spastic activity. Orthopedic surgery involves lengthening the muscles and/or tendons, realigning joints, and fusing the bones. Some signs of cerebral palsy are delayed development, abnormal muscle tone, involuntary movement, learning disabilities, speech problems, seizures, hearing problems, and vision problems. Cerebral palsy can cause the child to have many setbacks in their lives, but that doesn't stop them from having a full and happy life.